Hemolytic uremic syndrome. So this is a thrombotic microangiopathy. And what the heck does that mean? Microangiopathy means problems with the small blood vessels, tiny blood vessels. And you can see that the problem is because of thrombosis, okay? So what happens? Etiology is from bacteria that produce Shiga toxin. So the bacteria that do that are E. coli, O157H7, and Shigella. This Shigella toxin that they make will injure the endothelium of glomerular vessels. They're going to cause platelet aggregation and formation of microthrombi in these small vessels of the kidney. Okay, so you get these microthrombi, and what's going to happen, you're going to have red blood cells that are going to pass through, and because of all these thrombi, they're going to get sheared. They're going to suffer shear injury because they're like running through like a, I don't know, just a bunch of barriers getting hit, and they're going to get sheared. And they're going to break down into something called schistocytes, which you can see here. Okay, so you get schistocytes from this shearing. The other thing that happens is these microthrombi can occlude these vessels, these small little vessels in the kidney, and it's going to cause renal ischemia and acute kidney injury. Okay, so you get kidney damage and you have infection. So the clinical features here, what are you going to see? Well, there's a nice mnemonic for this called FAT RN, okay, and there's a FAT RN to remember for hemolytic uremic syndrome. We're going to talk about TTP in a second, but ignore this. Ignore this for now. FAT RN. First one is fever. This is an infection, so you can get fever. Anemia from the red blood cell shearing. This is a hemolytic anemia with schistocytes, okay? Because we're shearing our red blood cells and they're dying, so you're running out of red blood cells. Thrombocytopenia. Why would you have thrombocytopenia? Because we activate our platelets, and then they're going to form microthrombi, and then so you get platelet consumption, leading to thrombocytopenia, low platelets. Renal injury, we just talked about that. You occlude the renal microvessels, you get renal injury. And then here we kind of ignore this one. This is not as relevant for hemolytic uremic syndrome. And the other thing you want to know is there's a recent diarrheal illness. Why is that? Why would you have a recent diarrheal illness? Remember, the whole problem here is from bacteria. E. coli can cause you diarrheal illness. Shigella also causes diarrheal illness. So when you have to recognize this constellation of symptoms though. Fever, anemia, thrombocytopenia, renal injury. Make sure you recognize that. So it's like problems with labs, and then you have infectious symptom of fever, and then this kidney injury. And they just had a recent diarrhea. That's hemolytic uremic syndrome. So I mentioned that FAT RN is the same presentation as TTP, which is thrombocytopenic thrombotic purpura. But in this case, the renal symptoms predominate and not the neurological symptoms. We'll see in TTP that the neurological symptoms dominate. And the way you can remember this is just remember uremic. So if you remember it's uremic, that means the kidney is not working, so there's a buildup of uremia. When you focus on the name again, you also see there's more hemolytic. Hemolytic tells you a lot too. Remember, you get hemolysis leading to anemia, and hemolysis results from the platelet aggregation, and so you also see that platelet consumption. So next is thrombocytopenic thrombotic purpura. So this one is another thrombotic microangiopathy. This is more of a heme-related problem because, again, the kidneys aren't really affected here. But I put it here just so we can compare and contrast with hemolytic uremic syndrome. And the problem here is Adams Ts3 deficiency. What does Adams Ts3 normally do? It normally cleaves von Willebrand factor. Okay? It normally gets rid of von Willebrand factor. If this is deficient, you get excess von Willebrand factor. So you're going to get excess platelet activation and thus microthrombus formation. And then the same thing's going to happen. You're going to get microthrombi in the vessels, and then you get shearing of red blood cells. Okay. The difference here is these microthrombi normally occur more often in the vessels of the brain rather than the kidneys. So you get the same FAT RN presentation. What was the FAT RN presentation? F for fever, A for anemia, T for thrombocytopenia, and then you have less of the R and you have more of the N, which is neurological symptoms. And the other thing is you don't have a recent diarrheal illness, because the problem here is an inherent deficiency in Adams Ts3. Not inherent, sometimes it can be acquired. But in hemolytic uremic syndrome, it's due to a diarrheal illness from Shigella or E. coli that causes Shiga toxin. So that's it for hemolytic uremic syndrome and TTP. Make sure to keep these straight, both of them with a fat RN appearance, because they are thrombotic microangiopathies. They have schistocytes. Now I want to add in a miscellaneous pathology here, just so we can have less videos consolidate. Hydronephrosis, I've talked about this. This is dilatation of the renal pelvis and the kidney. As you can see here, there's hydronephrosis. And it usually results from urinary obstruction and then urinary buildup. So if there's obstruction here, then urine builds up in the ureter, so ureter gets fat and dilated, and then the kidney gets fat and dilated. Okay. One of the major causes of this is vesicoureteral reflux. This is less obstruction, but just urine going backwards, and so you get more urine in the opposite direction. Now I want to note again that serum creatinine only increases if obstruction is bilateral or the patient has a solitary kidney. Otherwise, the other kidney will compensate and you will still be able to excrete creatinine, so creatinine will still be normal. Now the other thing to note is that chronic hydronephrosis increases tubular pressure and causes renal damage. Okay, and that's because of compression of surrounding blood vessels. All these blood vessels here get compressed because of all that pressure, and you get tubular ischemia and you get renal damage. So that's hydronephrosis, complication of a lot of things that can block up the urinary tract obstruction. Alright, that's it.